Hello, I'm Dr. Russel Libby, and I welcome you to the world of medicine. Obesity is probably the single greatest epidemic to come to our country in its entire history. It is amazing that nearly 2/3 of our adult population is overweight, and probably over a third now are dangerously overweight, susceptible to all those diseases that we associate with obesity and being overweight. Type 2 diabetes, coronary artery disease, hypertension, arthritis, gallbladder disease, you name a long list of significant conditions that also have many conditions associated with them. It's expensive. It takes a lot of energy and vitality out of our society, and it's something that doesn't seem to be going away. And where does it start? Well, when we think about it, we say it's got to start with our kids. And in fact, what we are seeing is that our children are starting on that path earlier in life. We're seeing close to 2/3 of our young kids, our children in our population, now weighing in at overweight measurements. Why is it happening? Well, obviously there are lots of issues. We have a computer generation, people sitting in front of a screen, whether it's television or computer. We have fast food and fairly, I guess you could call it, satisfying foods that hit the palate and not necessarily what we need nutritionally. And we have kids who are in school and not getting an opportunity to be out and doing things to challenge and to exercise their bodies. So today, we're going to learn a little bit about what it takes, well, to become an athlete, to exercise, what kinds of things you, as families, as parents, and as kids can do to get your bodies moving in the right way. We're going to hear from people here in our county who are providing us with programs that help counsel kids and provide opportunities to learn about nutrition and to participate in great exercise programs. We have student athletes, we have adult athletes, we have even young kid athletes here, and we have an exercise physiologist, Laura Calderera, who is an employee of the Pediatric Cardiology Associates here in the Washington area. They have offices in Virginia and Maryland, and D.C. as well?
Not D.C.
Not D.C., okay. They leave that to someone else. But nonetheless, we're going to learn a little bit about what kinds of things impact athletes. If they have histories with the heart problems, if they have asthma, things of that nature. So we're going to find out a lot about athletes and exercise and some of those kinds of things. I'm going to start just by asking someone who looks like a pretty athletic individual. Did it just come to you? Were you born an athlete?
Basically. No, I started off doing things that weren't as challenging, like ballet, thanks to my mother. And then I had some family separation, and I got to play the sports I wanted to play, like soccer, which I played in college and now coach, and basketball, and believe it or not, football.
Oh, that's right, the football. They do have a girl here and there playing football in our county. What did you do on the football team?
I was a kicker.
You were a kicker.
Mm-hmm.
Did you ever want to field punts or actually get out there on the field and do anything else?
Well, in practice, I always kept up with all the guys, so why not?
All right. So exercise came to you in a pretty natural way, and you worked up to that level. I mean, to become really a scholar athlete, to be able to become an elite athlete and get a scholarship, you have to put in some time.
Yeah. Every single day was dedicated, whether it was practice, which I would have 4 times a week, and then 2 games on top of that. If it wasn't that, then I was conditioning those off days. So you really learn how to read your body and push through what seems impossible to get where you want to be.
So I guess growing up, you then had to commit yourself to routine hours on a daily basis and certainly plan your days around it. At what point as an athlete did you commit to a single sport?
I played basketball my freshman year, and then I was given the ultimatum by the basketball coach, and I chose soccer.
You chose soccer. In the whole process of being an athlete, did you ever have some fear that you could get hurt being an athlete?
Of course, but you always are gonna. You can get hurt doing anything. I mean, but if you take care of yourself and you're conditioning properly and working to make sure that your body's in the condition it needs to be in, you're going to minimize the chance of getting hurt. Some people are, have predispositions to being injured in certain ways, knees, backs, whatever. But for the most part, as long as you take care of your body and do what you need to do, then it can definitely minimize the risk. So I was never scared, per se.
Per se, okay. And you look like a pretty good athlete yourself.
Oh, thank you, yes.
What kind of sport do you play?
I play hockey and lacrosse.
Hockey and lacrosse.
And swimming during the summer, I guess.
And swimming, okay. And you found sports were pretty easy to get into?
Yeah, they were really enjoyable too.
Yeah. Now, do you have any issues that ever sort of interrupted your expectation in terms of your sports participation?
When I was a baby, I did have coarc repair and subaortic stenosis.
So you had some heart defects that had to be repaired when you were just a little baby?
Yes.
You don't remember that?
No, not at all.
That's fortunate.
Yeah.
How old were you at that time, do you know?
I'm just...
When they did the surgeries?
Too young to remember.
Too young to remember, so it was probably in that first year of life then.
Around there, yeah.
Tell me, when you chose sports, I mean, you must have been just an active kid anyway.
Yes.
You wanted to be active, and then you tried to channel it into some athletic endeavor, and then you had to pick your sport. Were you limited based upon what happened to you?
Yes, I was not allowed to exert myself like to maximum capacity, so I couldn't do football because of the weight training.
Right. Okay. So there are certain limits that come with that sort of thing. Laura, when we talk about kids and sports, and I think it's really important to sort of touch a little bit on some of the things that people are born with that may get in the way. And I think that a lot of parents probably have this great fear that their kid's going to be that one who drops dead on the field, in particular with football, I think, where there's a lot of strenuous activity, but any of these sports. Do we see many kids in our area who have a real bad outcome relative to sports and sudden death or any of those kinds of things?
I don't know that we see any greater number, obviously, than anywhere else. And there's always the chance, just like you said, of getting injured.
Right.
But if you look at the numbers, the tiny, tiny, tiny percentage of kids who might have a problem out on the field is just so small that unless you have a strong family history, you have a known cardiac defect, you have relatives, someone who did have an early sudden death for no apparent reason, parents should probably feel pretty comfortable knowing that their kids, as long as they're cleared healthy by their pediatrician on the routine exams,
Right.
should be just fine.
So, and when we think about some of those kinds of diseases, I know that there are some, and it's important probably to bring them out. The congenital, or let's say the kinds of problems that you're born with that can be corrected, they may affect how you can participate. And you might know a little bit about our fellow out here because you've worked with Bart before. But there is something called hypertrophic cardiomyopathy, which is probably the most famous one. When you hear about those athletes that drop dead, and it just hits the media, and it's just such a flash that you can't help but pay attention, and it's so tragic because this is an athlete everybody had expected to be so great and to achieve such incredible outcomes, and then they're dead, and you say it could happen to anyone. Well, it can, but at least there's a family history, and as you pointed out, that history in the family of sudden death is a real big one, especially prior to the age of 50. A lot of families don't know what that cause might have been, but you hear about an uncle or some other, a grandfather who had died that way. This is a condition where the heart seems to develop an abnormally thick interventricular septum. That's the wall between the two ventricles that pump the blood out to the lungs of the body. And it will impinge upon the flow of blood through the aorta and actually out to the body itself, and at some point can completely block, and there can be a sudden moment of arrhythmia and poor perfusion of the heart muscle, and that's what can go on. And I think that's an important one to be aware of. I think that when we screen kids in those pre-participation sports physicals, and as a pediatrician, it's going to be things like shortness of breath while exercising in a way that doesn't reflect, the normal conditioning issues. And we're going to learn a little bit about what people experience when they get short of breath, when it's related to conditioning or asthma or something else. But it's a very unusual one where you might start to feel faint. You might basically have to lay down. You may feel your heart pounding in your chest in a very strange sort of way. It's really a very, very hard thing to call because the majority of them do not have any symptoms ever in their exercise experience that might give them some tip-off. But just to give you numbers, when you look at the potential for a fatal event, it's probably from a heart issue, it's about 1 in a million in kids up to high school. It's a pretty good set of odds, and you wonder, is it worth screening these kids? And I know that when we look at some of the ways we can screen, echocardiography, where you use the ultrasound to outline the shape of the heart to make sure that the anatomy is normal, EKGs, electrocardiograms, you'd have to screen 200,000 kids to get one who you might save from a potentially fatal event. And at the same time, you would identify 1,999 of them who would be pulled out of sports because they would be at risk. And it's a difficult odds to deal with. And people have looked at it, it's so imprecise, so unpredictable, and so cost inefficient that it's not something we routinely do now in the schools or really anywhere at this point. They've done studies in other parts of the world. It just hasn't really amounted to enough to help us get a good understanding. But when people do come in to the cardiology office and they get screened, what are the kinds of things that you would do to look to see if they have problems that might warrant some adjustment in the kind of exercise they do?
Well, first of all, I think it's important to point out some of the things that maybe you need to be on the lookout for as a parent and as an athlete. If you ever did feel faint or dizzy or actually pass out during exercise. If you have chest pain that only comes on with exercise. If you feel your heart beating in an erratic manner with exercise. Those are things you certainly have to share with your pediatrician, and then they would come to the cardiologist. We would do an electrocardiogram. We would do an echocardiogram. And then what I do is the exercise stress testing, where you've probably all seen it on TV. You get hooked up with all the wires, and we make you slowly, gradually work up to a peak exercise level on the treadmill. And we measure through a mouthpiece. And I always tell our patients that you can see it on the Gatorade commercial where they're huffing and puffing into the mouthpiece and they're sweating crazy colors of Gatorade. That's exactly what we do. So by doing that, we can tell how well the heart and lungs pump oxygen all over the body, how well the muscles extract and use the oxygen. And it lets us know how efficient and how fit the kids are, that they're giving us a maximum effort. So I know they're not going to go out on the field or the ice or the court and push harder. So we know we've done as much as they can out there. And then if we don't see arrhythmias, if we see a normal blood pressure response, we're going to feel really good that they're safe.
So there are times, and I know that we have someone else who's also had some experience with being born with a heart that had some issues that certainly you have heart. You were born with some issues with your heart.
Yes, I was. I was born with transposition of the great arteries.
And it's an interesting one where they need to do surgery pretty early in life.
Very early.
Yeah. Do you have any recollection of when that was?
I do not.
No. But Mom might.
I do. I remember it very well.
Yeah?
Yes.
How old was he when he had
5
the
days
surgery?
old.
At 5 days of age. And did you know prenatally that was the issue?
Not at all. We did not know until about an hour after he was born.
Right. And we do see the more high resolution ultrasounds now in pregnancy so that we can pick these things up a little bit earlier and be prepared. So you were lucky that you had, I guess, people who were sensitive to what needed to be done.
That's right. The
And when to
cardiologist
observe.
came in and was able to determine what was wrong, and then we had a great surgeon and great cardiac care to take care of us throughout the years.
So was he vulnerable in your eyes in terms of if he ran around the house, did you worry that he was going to
Yes.
have something bad happen?
Yes.
They'll do.
Did you sense that too?
No, I did not.
No? Okay. So it probably took you a little while to get used to seeing him
Yes, it
just
did.
exert and run and fly and do all the things kids do that you wish you could do as an adult.
That's right.
Right. So at what point did you start to get involved with sports?
I got started involved probably in 1999. I started doing soccer for BRYC.
Okay. And you were how old at that time?
I was probably like 8 years old. Yeah,
Okay.
8 years old.
Good. All right. And at that time, you really had no fear of your heart. Did you have to have it evaluated and make sure that you could do the kind of activities that you wanted to do?
Well, with the routinely checkups of my cardiologist, we had confirmed what sports I could and could not do. Soccer was one of the sports I could do, as long as there was no like rigorous weight training.
Right. Okay. So, and you've been supporting him through all of that?
Absolutely.
And it's been great for him?
Absolutely.
All right. Good, good. And you know a bit about his procedure, and you've actually done some testing. When we do those screens, of course, once again, blood pressure is a big one as well. So you were talking about no weight, sort of high, I guess, heavy weight
Sure.
training. And when we think of weight training, we think of people doing major resistance exercises that will increase their blood pressure. So there are certain conditions where that's something that you have to be careful about.
Sure. We don't want to increase the blood pressure to such an extent that the blood coming out of the aorta that goes to the body is under extreme pressure, because that'll wear down that valve. In some diagnoses, it actually has the potential to make that valve just clamp off and stop, and then no blood comes out at all. A lot of it is more a long-term effect. We want to make sure that these guys stay healthy for long-term, yet they're still getting the benefit of regular exercise. So we usually give them a guideline. Patients always ask me, how much weight can I lift? I can't tell on an individual basis. So we tell our patients with congenital cardiac disease, if they can do 3 sets of 15 of any given exercise, then they can move up to the next weight. So we encourage lighter weights, higher repetition, as opposed to, like you said, the powerlifting where they're really struggling and pushing and grunting through, which is more apt to increase that blood pressure.
Yeah, there are a lot of phenomenal athletes. In fact, one that comes to mind was last month with the X Games in Aspen. One of the snowboarders, Shaun White, who's famous for winning the, I guess, first place in the freestyle or whatever it was, year after year after year, actually had tetralogy of Fallot.
I did not know.
And was operated on as an infant, and then I guess he had a 2-stage procedure or whatever. But nonetheless, it just goes to show you that you can be born with disorders that can really have some great risk and really succeed in life. We've got a couple more athletes over here as well. What do you play?
Soccer.
You're a soccer player.
Yes.
And do you feel like sports came to you just like, you know, water to the spring? I mean, it was just so easy for you to just get right into it?
Well, I started off as a ballerina and a dancer with Mom's will, and then my parents got divorced, same as Kat, and Dad signed me up for all the sports, so
So on
came
the
pretty
weekends you were
easy.
with Dad, you were playing
Yep.
soccer?
And Mom didn't know.
Of course. And then, of course, what ended up happening was that you were actually a better soccer player than ballerina.
Yes.
And that's a good thing.
Yeah.
So you've enjoyed soccer, and it's been a good career. You're now playing in high school.
I play for Chantilly High School.
Okay, and you do as well. So you guys are teammates. That's great. Good. You're going to have a good season this year?
Yes.
All right.
We're going
good.
to States.
You're going to go to States. That's what I want to hear. So you've been a pretty healthy person. Are there any things that happen to you while you play soccer that worry you or that get in the way of you being able to perform at your peak?
I was diagnosed with sports-related asthma, and what happens is when I exercise, if I don't take my albuterol inhaler, I just start wheezing and can't breathe and have to stop.
So when did that start to become a problem for you?
Probably when I was 14, 15, once my serious soccer started, and I was practicing 5 days a week and for long periods of time. So.
Yeah, and are there certain conditions where you find that happens more easily?
It happens more often when I'm indoors, when it's humid out. So
you're a little on the unusual side from that point of view.
yeah.
Because most exercise-induced asthma is going to be in the colder, drier
Yeah.
area. Okay. And when your symptoms start, let's say you start to run, and you're generally at a pretty high level of exertion, and usually it's aerobic.
Right.
And how far into exercise will you experience some difficulty with breathing?
Within the first 20, 30 minutes.
And do you get tight in your chest? Do you get chest pain? Do you start to wheeze, cough?
I start to wheeze and cough and gasp for air, and I'll just have to stop. I'll get chest pains. So,
How long does it take you to recover when that happens?
about 15 minutes.
Okay. So it takes some time. It's not like just you're out of breath. And you gotta
Right.
catch your
No,
breath.
it doesn't just go away.
And if you have your inhaler there, that'll help
Right.
some. So it is important for you to be using your inhaler beforehand.
Yes.
Yeah, exercise-induced asthma, now that's a lot more common than the cardiac issues we were talking about. I guess it's something like about 15% of athletes will have that kind of condition. You see it in the office because I'm sure it's associated a little bit with the cardiac issues.
It is, and the majority of our patients that come in for exercise testing come in for some type of chest pain. And when we do a history beforehand to try to figure out just exactly what kind of chest pain, and just as you described, the sort of symptoms we're looking for, and you think, this is very likely exercise-induced asthma. And again, we can test for it in the lab. We do some pulmonary function testings before we make you run, and then after, and we repeat it out about 15 minutes after, because like you said, it doesn't stop when you stop. And that's one of the big things, one of the big clues when we're looking at exercise-induced asthma, when it actually sometimes gets worse in recovery, and that tightness and feeling that you can't breathe. And then we have a nebulizer we can give, and then retest pulmonary function again to see if we see an improvement.
See if it comes back. Now, when you were exercising, there were times during the season, I guess, when you would start. And did you ever have a diagnosis of exercise-induced asthma?
Well, I was never diagnosed with it. I experienced challenges, I guess, in my breathing. But then as I progressed as an athlete, I started to realize that it wasn't sports-induced asthma, it was just me being out of shape.
Right, okay. So, and that's an important point, because the fact is that a lot of it is related to conditioning. And you'll find early in the season, when it might be colder out and they're pushing you to work out outside, that you're out running around and you get out of breath. And you're hoping that maybe it's exercise-induced asthma, because you don't want to have to get in shape that hard. So you're trying to find a way to make it easier, and it takes a couple of minutes if you're out of shape to catch your breath, get back to the field of play, as opposed to with asthma, you're going to really get much tighter, and it's actually going to get worse over the next 10 to 20 minutes, and often will peak at about 15 to 30 minutes, and may take a longer time to resolve. And it's a pretty clear pattern that we see. Like I said, 15% of athletes may have some degree of that exercise-induced asthma. Probably if you have asthma itself, otherwise probably 90% will have a precipitation of wheezing when they get out there and they start to play hard. And if you just have allergies, you're still going to be prone to it. Probably about 35-40% of kids with plain old, allergic rhinitis. But there are situations where there is going to be more of an issue with exercise-induced asthma. If it's hot and there's a lot of pollution, and that you may have some allergies too, and the pollen may precipitate a little bit more of a sensitization, and that's why at that time of year it's more pronounced for you. If it's hot and if it's polluted, it doesn't make your lungs really happy to be breathing that hard and all that air. There are people who have asthma and need to be on their medications and be controlled quite properly, and that doesn't always happen either. So it's an interesting phenomenon. There's another one, though, that we see more often in girls than boys, and that would be something that on the field you may have experienced. And did you ever see anyone who was playing for a few minutes in a pretty high-level competition, then all of a sudden couldn't get their breath at all, just struggled? And squirm to try to breathe?
Yeah, actually. On my club team, before I went to college, there was a girl who played, and she had to use her nebulizer, I guess it was,
Right.
before bed and in the morning. She had bad asthma, and I see her go in fits a lot.
Right.
But she still went on to play in college and tried to keep it under control. and
So
everything.
those fits, would her voice change when she tried?
She could barely get words out.
Okay.
So
And what she had was a different diagnosis, and it's a great history there because a lot of people think that's exercise-induced asthma, and you can have both. But that's what we call vocal cord dysfunction. Tell us a little bit about what that is and how we see that in the
Well,
lab there.
Pretty much exactly what you said, and a lot of people come in saying they're wheezing, it has to be asthma, and in reality what you're hearing is them tightening their throat, that breathing, and it's up here, which is different from a true wheeze, which you'll hear down in the lungs. But it's concurrent with a lot of times, and it's often confused with. And in the lab, we'll see completely normal pulmonary function tests pre and post exercise, yet we can see and hear what exactly you described. And so it's almost without going forward and putting a scope down their throat to look at their vocal cords, we sort of rule out other things and say this has to be what we call vocal cord dysfunction.
And it's an incredible phenomenon. It is that when we breathe, the muscles in our larynx spread our vocal cords apart so we can get as much air in there as possible. And for some reason, under certain situations, there's a paradoxical narrowing. And instead of having them wide open, they get more narrow. And at a time when they want to breathe, they're on the field of competition, they're running, and all of a sudden it's tight, they panic. And it's one of those things where you see them really have an acute episode of shortness of breath, panic. They have to run off the field. Often they'll cry. These are often, well, your type A kids too, who are easily, I guess, susceptible to stressful moments. And it's a phenomenon to be aware of because you'll see it and people will think it's something else. But it's certainly something good to know about and certainly something good to work with. So you've been sitting up here pretty patiently, and I know that people would say, well, does this guy exercise? Do you exercise?
Yeah, sure.
What's your favorite type of exercise?
Playing video games.
Playing video games. What kind of video games?
Finger ones.
Oh, so these are thumb exercises you're talking about.
Yep.
Right, okay. Do you play any competitive sports?
Yeah, I play something called power soccer.
Power soccer, that's kind of an interesting concept. Tell me how that works.
Well, we put like a guard thing in front of the chair, and there's like a giant ball, not a small soccer ball, but it's like a lot bigger, and we hit it with the guard.
So you hit it with a guard, okay.
Yeah.
And how many people will be playing on the field at that time? I mean, how many people play in the team, for instance?
I don't know exactly. When I played, we played with like a smaller team with only like 3 people on the team.
Okay, because it sort of takes a lot of space. You're in your chair, right? How did you get him involved?
The PE, he takes adaptive PE at school, and the adaptive PE teacher just gave us information about it. They were trying to start up a team here in Fairfax, and it's an amazing thing, actually. They have competitions. They have regional competitions. They have international competitions with kids playing power soccer in their wheelchairs.
Wow.
And we were very excited to get Kane involved in that.
So, and that's a program through our county.
Yes,
Yes.
Fairfax County.
And tell us why is Kane in a wheelchair?
Kane has Duchenne muscular dystrophy, which is a degenerative muscular disease. So he basically has weakened muscles.
So it's hard for you to sustain a lot of running. Yeah.
Yeah.
Yeah. But you find some way to stay active and to enjoy sports.
Yeah.
That's great. So, and
Nothing else.
and nothing else. Well, that's okay. And do you play sports yourself?
I don't play sports, but I was a dancer, ballet, jazz.
Your father didn't make you play soccer, then? I think.
No, I did a lot of ballet for a good 15 years or so, and I also did taekwondo. And Kane was in taekwondo also when he was 4, 5, and 6 years old. So we did a lot of that.
So that was before the weakness got a little
Exactly,
worse. Yeah.
exactly.
Okay, good. And we're and you're Kane's little sister, yeah? And do you like to play sports too?
I don't play sports.
Not yet?
I just play ballet.
Oh, you're a ballerina too.
I used to swim, but
You used to swim. Yeah, when you were a little kid?
I don't know when.
When?
And
Yeah.
one of my friends was in gymnastics, so I started going to gymnastics, but not that long because she got scared.
Oh, I see.
I didn't.
Okay, well, you know, as they start to challenge you to do more, let's say, dangerous things, I guess gymnastics can be a little threatening. And we got another soccer player here, and I didn't ask you, anything that happens to you playing soccer?
Like what?
I don't know, any kind of aches, pains, or things that have been unusual for you?
Well, for a while when I used to play soccer, I'd get really bad stomach pains, and it caused me to have to sit out for a while and missed a lot of school because of it.
Okay, so there are other types of problems that people can have that can interfere with their ability to perform. So sometimes it may be something like reflux. It could be something else that goes on with their body that causes them some discomfort. When we think about getting people in shape, what are some of the ways? I mean, you must get some of these kids who come out of cardiac surgery and they need to start exercising on a regular basis, and you want to get them in shape. What are some of the ways and some of the programs that you as an exercise physiologist would start to use that way?
Certainly for any patient who has had cardiac surgery or has a cardiac condition, they would have an exercise test, and based on that, we would know what they could safely participate in. But with anybody, just starting an exercise program, there's 4 things that we sort of have you focus on, and it spells a nice little FIT, to get fit. It's F-I-T-T. Frequency, how often should I exercise? Intensity, how hard should it be? Time, how long should I do the exercise? And type, what kind of activity should I do? So we focus on those things for our patients as well as in general. I also do wellness counseling for kids who come in with high cholesterol or obesity or hypertension, high blood pressure. And it's the same thing. The recommendation for all children is to do 60 minutes of some moderate, intense aerobic exercise every single day. So if you look, the FIT, we've got all 4 covered right there. Sometimes it takes a little more information for people to actually put that into action. And we try to give a little more information about types of exercise, things that you enjoy. Obviously, ballet didn't work for you guys, worked great for you. So fantastic, because it is a great exercise. Soccer, fantastic, you loved it, and that's why you kept doing it, and obviously you kept dancing. So we really encourage all of our patients to find something they enjoy or some things they enjoy, and to focus on those, because then exercise is fun and not work. And then the other things just tend to fall into place in terms of the intensity and the duration.
Well, I want to hear a little bit about, if I can get this mic to come all the way back out here. We have someone from one of our local high schools. Almost, there we go. Let's see. All right, here we go. So you're from
Chantilly High School.
And you're the athletic director?
One of the assistant athletic directors,
Okay.
yes. Yes, indeed.
And you watch kids. Do you think that kids are getting enough exercise?
I would say, some are, some aren't. I mean, again, they have so many distractions in today's world, it's kind of hard for them to do. I think our student athletes, they get plenty of exercise, and again, being an athlete or trying to be an athlete or participating in a club or a sport, it produces a better overall person, better overall athlete, student, self-disciplined young person. So I would say today there's more focus, and the kids are a little more focused than they were maybe 5 years ago. I think today is better with all the knowledge that's out there and the information that's going on.
So do you think that the schools provide enough time for kids to get physical activity if they aren't involved in an extracurricular sport?
Well, we require, again, Fairfax County requires the kids to take physical education 9th and 10th grade. We offer other classes as well as weight training, which I've taught for many years myself. So there is opportunity for the kids. We encourage them to take it their junior and senior year as well. But again, we like to preach once you get to that level, we want to encourage them to maintain a level of fitness or to want to do it down the road. So our classes in PE now are more core based on core exercises, and we're trying to teach lifetime activities that they can do down the road. But yeah, I would say, to answer your question, yes, I think so.
So they're starting to focus a little bit more on using the quality time they can at school for those kids who might not have the opportunity to get outside or to have any physical activity in any other part of their lives.
Yeah, definitely. I would say that would be definitely true.
I mean, school's important for that purpose. There are a lot of kids who grow up and really have no opportunity to actually get outside and do some of those activities. I know you're involved with some of the county programs. Now, you're not with the schools.
I'm with the Community Recreation Services of Fairfax County.
And what are some of the kinds of programs that you folks put out there?
Well, actually, we have programs for kids who are obese, kids who just want to get healthy. We have the Energy Rocks program that we're doing with staff and also we're doing with teens. We have the Catch Kids Club, which is it's got 300 activities. It's for kids who are teenagers, youth, and it's in our community centers, teen centers, therapeutic rec. We also have individual programs that are in our community centers and teen centers that's specific for those areas.
So you guys can really set up some pretty interesting opportunities for kids. Absolutely. You get involved with a lot of them.
Yeah, we actually, Teen Centers oversees the Energy Rocks program, and it's really a program of accountability. It's they wear pedometers, and they increase every single day. If they walked 500 steps yesterday, our goal is that they're going to go to it and challenge themselves just as an individual to do it again. We've ran that in Teen Centers for about a year. Now it's moved to the county staff. And we're hoping that just them as role models within their families and their programs are going to see the motivation that we have as adults. And then hopefully by summer this year, 2009, Energy Rocks will roll out to all the programs.
Give me a little sense as to how people get referred to the program and how accessible it really is to people around the county.
Anyone can get referred. It's some schools do it. We had a consultant, Dr. Jim from Inova, that was referring kids to us. Right now, for the most part, the kids come in, they sign up. Right now, the fitness one that we're doing with the adults is a 15-week program. We're going to stop in May and then roll it out to any of our summer programs. It's for every fitness level. It's from beginner to very highly advanced, people that work out all the time. So it can kind of be maneuvered any way, and it actually even goes into the senior citizen population that we've now figured out how to roll it out to them as well. So they just call, they get signed up, and we kind of work it, and it's a very easy program. It's all self-accountability. They can do it every day, 7 days a week, or they can do it 2 days a week. It's completely up to them.
Does it cost?
It absolutely is free.
Free. So you give them nutritional education.
Absolutely.
You work with an individual basis. You create exercise programs and help them work up to certain levels of performance.
And we have a weekly email that's going out right now to staff just to keep motivation up, fitness opportunities in the area like 5Ks that may be happening in Fairfax County, making sure that everyone in the county knows all the trails and parks that that are in their backyards that they may not know about. So we do some environmental scans as well.
And certainly we pay a lot in our county taxes.
Absolutely.
To have those trails out there.
Yes.
You ever run on those trails yourself?
No.
No?
No.
Does she make you exercise? Or you're just a super jock because you love to exercise? Is that right?
Uh-huh.
Yeah. And you too?
I just play football and I ride bikes on the trails.
All right. Well, bikes on the trails, that's a great exercise too. So we get some motivation from the county and we have opportunities there. You're talking about how important it is to have exercise as part of your life. How you're involved with the psychological care of people in general. Tell us a little bit about where you come from and what you do.
I own a practice with a partner, and there are 12 of us actually, 12 clinical psychologists. We work with kids, families, a lot of teenagers, and adults. And we deal with psychological testing and psychotherapy. So a very broad range
Okay.
Of
So
clients we see.
Okay. And you are particularly focused on exercise because you feel, well, I guess you were athletic as a child.
Yes. Yes, I
No,
was.
it gave you balance, and
it did. It
as
did.
As our athletic director said, it put perspective into your daily routines that kept you a lot healthier.
Yeah, absolutely. And, you know, all the clinicians at Mindwell, at our practice, we all will advocate for exercise for our adults, for our kids, for the real little ones. It's such an important way to build self-esteem for kids. And it also, I see you nodding, and it's so true. It builds so much self-esteem. And it increases endorphins so that the brain is functioning better. Kids tend to focus better in school. They don't get involved with drugs. They don't tend to, statistically, they don't tend to be involved in drugs.
Right.
Less teen pregnancy, just a huge empowerment that goes along with it. And so it is really important.
As a psychologist, you probably also see some kids who, well, or you might know something about kids who may exercise in a way that might not actually be healthy for them.
That's right.
You know, I know that as a pediatrician, I will see kids with eating disorders, and in particular girls, as they're going through the throes of that delusion of, I guess, the body dysmorphic experience where they look in the mirror and they see fat when there's barely skin and bones.
Right.
But they tend to exercise.
They do, and you know, there's a real broad range. I mean, with anorexia, you're going to see absence of eating.
Right.
Then you're going to see kids that are overeating and they're purging. And then you're going to see kids that are overeating or not eating at all, and they're exercising a lot, too much. They're waking up at 5 o'clock in the morning, they're running 3 miles. They're running 5 miles after school. And it's not often that you'll see a child that's real thin. It's undetectable sometimes. And people will say, oh, they're an amazing athlete, they love to work out, but it's about control.
Right.
They feel somehow that they can get control in their life if they can control their weight or the way they look. And the treatment is typically family systems based, can be cognitive behavioral. But eating disorders are very, very dangerous, and families need to acknowledge them. Often they're kind of swept under the carpet because they're kind of under the radar, and they tend to be very compliant kids, good students, you know.
So we're going from the other extreme, from the no one exercises and all they do is eat McDonald's,
right,
and not the right McDonald's meals, and now we're talking about someone who eats right and exercises too much and actually has some underlying eating disorder. So it's something to be sensitive to for sure.
Yeah, and it's something that families really, it's okay to get a consultation.
Right.
You know, it's okay for folks to come in and see us for an hour and a half and talk about it.
Right.
And see if there is a problem.
Right.
If there is, it can save their life. There's a lot of cardiac issues that go along with eating
True.
disorders
True.
that are killers, you know.
And you're involved with another part of the county as well. You do some other programs. You actually oversee a lot of these programs.
Well, I work in the Therapeutic Recreation Division, which we have a lot of different recreational programs for individuals who have a variety of disabilities. We work with individuals who have physical disabilities, cognitive, developmental, emotional, and kind of do the whole gamut. And it's basically providing recreational opportunities and exercise opportunities for individuals who have disabilities.
And that's a real challenge. I would imagine there are a lot of situations where you really need to keep people fit and you need to keep them healthy, and they may not be able to socialize in ways that make it easy for them to participate in team sports or to follow directions in the routines.
Absolutely.
So that must be quite a challenge.
It is. It's often that they live, you know, very sedentary lifestyles. So it's nice to be part of something that allows them to be active. You know, we've got wonderful staff that kind of work to help develop and modify, like the Energy Rocks program, so that kids with disabilities can participate in it and really get that same, you know, cardio and all the same kind of benefits that people have been talking about through exercise. And
I suppose also there's some sensory integration issues.
Absolutely.
Their balance isn't that good necessarily. They don't have the right kind of muscular tone to be able to do some of the more challenging kinds of exercises.
Yeah, every child's very unique.
Yeah, and you're what we call a parent advocate.
Yes, I am.
And you got involved with these kinds of therapeutic endeavors. How?
My son has autism. He's 10 years old. He's been participating in various county therapeutic rec and other types of programs for about 4 or 5 years. You know, we have a problem. I can't say most kids, but a lot of kids with developmental disabilities have very narrow ranges of interests. Television, computer, a few other things. Very limited diets, too. And they're not reaching for the raw vegetables. But he needs, essentially when it comes to physical activity, he needs the same thing that he needs in the classroom. He needs low ratios, he needs constant positive reinforcement, and he gets that from therapeutic rec and also the other program, Adapted Aquatics. They've taught him to float, and maybe a couple more classes he'll swim.
That's
So,
pretty exciting,
yeah.
actually. I'm sure it's something that you often wondered if you could ever have the opportunity to trust him in the water even.
Right. That's always a concern for us. He's very drawn to water, so.
Well, that's great. And you're a sister?
Yeah.
Yeah, so you've been watching this go on for a while. Has it been encouraging for you to watch him start to get involved with some of these sports?
Yeah, because it like if he can do it, then it makes me feel like I can too. Because
Right.
he actually needs to do it.
Right, and it's hard for him to organize his day or his space into one that participates in those kinds of things. Does he bring it to you? Do you guys relate well at all in terms of your exercise experience together? Does he like to do it with people?
Well, sometimes it kind of depends what it is. Like if we're in a swimming pool, depending on his mood, sometimes he'll let me play with him. Sometimes he'll just kick me out.
Yeah. So you have to go with the flow, I suppose.
Yeah.
Yeah, it can be difficult. But it's good that we have programs that are going to help those kinds of kids and get them really active and going well. I know that there are a lot of kids who will use the Wii and the new technology. Are you one of those little Wii guys who like to play with the Wii technology? Yeah?
Yeah.
What's your favorite game to play that way?
Guitar Hero.
I'm sorry?
Guitar Hero.
Yeah, and the Guitar Hero. I see. So you get to rock around, windmilling your arms and jumping up and down like you're playing up on a stage in front of thousands of people.
And we fit it. I like snowboarding on We Fit.
Okay. The Wii games, you know, they're a big one, and I know that there are lots of potential applications, and people think that at least they've gone from just using their thumbs to using a little bit more of their body. Is there really any exercise physiology involved in most of those games?
Many, no. But it is encouraging because kids now, there's a video game that I don't, abhor. In fact, we bought the Wii, and my almost 5-year-old plays tennis, and he's all 4 people on the court. I don't know if you've ever seen how Wii tennis works, and I don't know how he sets it up either, because he's 5 and he knows more about computers than I. And when he's done, he is dripping with sweat. He gets a really good workout. There have been limited studies, and they do show some good fitness benefits. There's one little caveat, and that's some overuse injuries they're seeing now. People showing up in the ER with Wii elbow and Wii shoulder, because it is it's repetitive. You're using that remote control arm to do whatever that motion is.
Right.
So just be aware of that. But it beats the thumb exercise for sure.
And then there's that baseball through the
You got to wear the
video
wrist
screen,
strap.
Right, you have to be careful not to let go when you throw things at the television, right? Yeah.
That's important.
But it is interesting because I think that there is an opportunity for at least some additional activity, and I guess the dance revolution, those kinds of games have really gotten some kids to at least get more active. You were probably growing up at a time when that sort of became part of the culture of sorts. Did you know lots of kids doing that?
I never played video games.
The dance revolution, did you ever do any of those?
No, I've actually never done that. But some people, when I was in high school and it kind of started, some people did. I never got into it. Yeah. But, I mean, they actually would be sweaty after. They'd be working hard.
It's a good piece of workout. Yeah, no, that's what they say. You participated in this?
Not in the dance revolution, but I wanted to comment about the Wii.
Right.
Because my son has limited movement in his
Right.
lower body, I really appreciate the Wii because he's playing tennis and he's swinging his arms and he's doing things that he would not normally do. So I can see him moving his body around, and that's exercise for him.
Yeah. And
So
it's
we like
hand-eye
it.
coordination still. It's a real good developmental treat for your brain.
It is.
It gets it working, right? It's going to make it much stronger and much better for you all the way through. Well, the Wii, I know in the senior age group as well, is something that will get some of those people up and doing some things that are pretty interesting.
That otherwise wouldn't, sure.
And we'll see what happens with that. I think that people may be deluding themselves thinking that they're getting a good workout necessarily, but still, it is a step in the right direction. You're a coach.
That's
it
correct.
says right there. I know that. What do you coach?
I coach high school ice hockey.
High school ice hockey. That's a great, great sport.
It is a great sport.
And this year, it just so happens to be a really a wonderful sport for the Washington area.
Yes, the Capitals are doing well.
Yeah, they are. We have possibly the greatest hockey player that ever played in Alex Ovechkin. And certainly I know that Bart thinks that one day he will surpass him in both number of goals and the flair with which they were scored. When I think of kids in sports, and in particular those that are competitive and as they get into high school, there is a lot of, let's say, pressure on them to perform and to get bigger, to get stronger. Do you find that kids are using performance-enhancing nutritionals or other substances? Do you ever hear of that going on with your athletes?
Not with my athletes. I think hockey is a little bit different sport in that you don't want to bulk up too much because you want to be, flexible and agile. And the more you bulk up, you kind of take away from that a little bit. So, in terms of weight training, don't encourage them to, go to the gym and lift, as much as they can, more of the repetition, and try to get tone as opposed to muscle mass.
Right.
In terms of performance-enhancing drugs in hockey, even when I played, that wasn't an issue at all.
Wasn't a big issue, yeah. Now I'm sure that you're around other types of athletes. Do you hear kids talking about using different types of either the things you can buy in the GNC store or things that you might have to buy in the black market or whatever you want to call it?
Well, for football and hockey and lacrosse and those kind of sports, it's more of like GNC stuff like whey protein, muscle milk. And then I guess on baseball you get more into those steroids and stuff.
Yeah. Oh, well, of course, we've been hearing lots about steroids in baseball. But it is an important issue, and I think it's certainly one that deems a little discussion. There's so much out there that people get promoted to buy, the nutritional supplements, whether it be protein, whether it be vitamins, creatine, all the power drinks, the things that are full of caffeine and sugar that people think are going to give them a jolt and give them some extra energy. And kids are using these thinking that they're going to play better or be stronger. Do you have any perspective on the nutritionals? Because I'm sure that you hear some of it as an exercise.
Sure, yeah, we get asked very, very, very often. And first of all, people need to understand that supplements, the powders, anything you can buy at GNC or any of the other health food kind of stores aren't regulated by the FDA. So we don't know if they really do what they claim to do. And you don't even know from one can of that powder to the next if it's the same, if it's got the same makeup, because that regulation just isn't there. I think the biggest risk for most kids is it's a waste of money. Unless you are, and the evidence we have so far says, unless you are a really highly trained power lifter, world-class sprinter, the advantage you're going to gain from that protein supplement is so minuscule that it's not going to matter in the level of competition that you are competing. So in reality, it might make you feel like you're bulking up, but it's the exercise and the work you're doing that's going to give you the advantage, not something out of a powder.
Yeah. So basically you're going to have very expensive urine, is what you're telling me.
Yes. I tell my patients, just give me the money instead of flushing it.
Right. Yeah, I think that what you see, and what I see incredibly are kids with these tubs of protein. Yeah. They're bringing home, they're making milkshakes. And basically your daily requirement for protein is not quite that high. No. What is it, somewhere in, I mean, most...
At most for an athlete, probably 80, 90 grams.
80, 90 grams. And you think, all right, what does that mean? Well, 3 ounces of beef or fish or chicken is about 20, 22 grams, depending on how lean it is. You know, a glass of milk may be about 12 or 14 grams. So it doesn't take a lot of normal nutrition to really get that protein requirement. Even those who are really elite athletes who may be burning a lot of protein and need that to bulk or to at least replace, even still, I mean, you're talking about maybe 120 grams in a day. You're not talking about 500 grams, which is what you'll get in a couple of scoops of the protein powders. The protein powders, fortunately, don't end up being retained by the body. They are excreted. There is a very small number of athletes who basically, if they take them at the right time after a heavy exertional workout, and that means hours weightlifting in the gym, aerobic, this, that, and the other, if you take those supplements right there at literally at the termination of that workout, you may get a small benefit and incorporate some of that protein. But most of it's just wasted. Most of it is pure profit for whomever is making it and selling it. And creatine is another one of those things that kids sort of get hooked on, but it's a very specific population that would require it.
Just had a thought in regards to performance-enhancing drugs. You know, while as a coach and a former athlete myself, never got into any of the performance-enhancing drugs and the GNC stuff. When I was in college, one of the things that was quite popular that I think became a banned substance, but now you can buy it again, is ephedrine. Yeah. And that's something I know a lot of college athletes and some of my friends, and I'm not encouraging it at all, take to get that extra edge. Right. And I guess you would consider that a performance-enhancing drug, although it's not illegal. The use of it was, quite common, which, I think can lead to, a lot of different problems.
Yeah, well, and that's a whole other story in terms of the gateway drugs. Ephedrine is like pseudoephedrine, and it can be very cardiotoxic, can be very dangerous. Anyway, we're out of time. Can you believe that? I thank you all. You've been great. It's been an interesting hour. And I thank you for joining us, Laura, and I thank you for watching. And make sure you stay with us from month to month with our shows. Until the next time, I'm Dr. Russel Libby, looking out for your health. So at this point, the audio is off, but the video isn't. So